Vericose Veins by Sarah Ann Burcham. Vericose veins occur when veins become enlarged and tangled. This usually happens in the legs and feet due to the pressure buildup in the lower extremity from walking and standing upright for long periods of time. And it's hard for the body to pump the blood back up to the heart. People that generally get varicose veins is due to their age because of lost elasticity and the valves become weak. Also due to pregnancy because there's an increased volume of blood being pumped to the fetus and a decreased flow of blood from the legs to the pelvis, hormonal changes, and generally these will improve 3 to 12 months following pregnancy. Your veins are working hard to pump deoxygenated blood from your feet up against gravity, and sometimes this blood will pool and you'll get enlarged veins, hence the word varicose. How do varicose veins affect someone? Generally, it's a cosmetic concern, but for some people, it can be more serious. Sometimes you'll see aching pain or discomfort come along varicose veins, also like the burning we talked about last time. If this does happen, it could cause a lack of range of motion or strength due to the pain. You can also sometimes see circulatory problems, which you could see then loss of sensation, shortness of breath. With this, also be an alert, look out for blood clots, bleeding, or ulcers that can also occur. And your main people that can be at risk are females due to pregnancy and hormonal changes, birth control pills, family history, obesity, or standing or sitting for long periods of time. Varicose veins are generally dark purple or blue due to deoxygenated blood. Veins will appear twisted, bulged, you'll have achy or heavy feeling within your legs. You'll often see burning, throbbing, muscle cramping, and swelling in your lower limbs. And the pain will worsen after long periods of sitting or standing. Also, sometimes you'll see bleeding from the varicose veins. It's important to know if you see any color changes, hardening of the vein, inflammation of the skin, or skin ulcers that develop around the varicose veins in the ankle. It's important to report that person to a physician. Medications are not usually prescribed for someone with varicose veins because usually it's just a cosmetic concern. So usually doctors recommend exercising, elevating the legs, and also wearing compression stockings. But if they do become worse due to symptoms and become a bother, then they'll do surgery, which can be closing the veins using sclerotherapy, laser therapy, endovenous ambulation therapy, and endoscopic vein surgery, or they could just remove the veins entirely using ambulatory flebectomy or vein stripping and ligation. Prevention for varicose veins is generally just exercise, watching your weight, eating a high fiber diet or low salt diet, avoiding high heels and tight hosiery, and then elevating your legs as much as possible and just changing from sitting and standing positions regularly to make sure you're not standing or sitting for long periods of time. A few studies I looked at compared risk factors. Another one looked at treatment of varicose veins. Sorry, girls, but we're at the greatest risk factor because we are women. We're not quite over the age of 35 yet. If we have partners, generally because then we most likely will have kids, and also for graduate students or above, which would be all of us, mainly because we're probably sitting for long periods of time every single day, according to Gomes et al. Also, they looked at creating a replica of a varicose vein in order to further the treatment and look at how ultrasound therapy would affect varicose veins, and they found that it does increase the temperature of the surrounding tissues and the contractility of the vessel that they used. So they are still looking into further research and seeing if they can maybe help treat varicose veins. Varicose veins are relevant to the top 20 because it disrupts the flow of blood to the body due to the many twists and turns in the vein and the number of valves that tries to increase the pressure to pump that deoxygenated blood back up against gravity to the heart. If so, this can also cause blood clots while that blood is pooled in the lower extremity, which then can also travel up to the heart or lungs. You could see a heart attack, you could see pulmonary embolism, you can see um, just basic difficulty breathing because you have all this deoxygenated blood that is pooled in your lower extremity. Thank you guys all for listening. Here's my Works Cited page.